right, 5 minutes after 11 o'clock, nice looking Wednesday morning. You know that music. That means that Dr. Riyad Makori is in the studio. Today is November 7th, 2012. If that's the date where you are, then you're listening to a live show. This is the Head to Toe Care Show. Dr. Fakori is a chiropractic orthopedist and the owner of Fakori Medical and Chiropractic Center right here in Ocala at 1009 Southwest 16th Lane. And the phone number at his office is 352-351-3413. Right now, though, the phone line is your connection to Dr. Fakori here in the studio, and our number is the Climate Control Source Hotline, 622-WOCA. Good morning, Doctor.
Good morning, Larry.
How's everything?
Everything's great, thank you. Everything's fantastic.
I was reading an article, and I thought to myself, I've never heard you talk about this before.
Oh, is that right?
Apparently...
We've done the head to toe. Did we miss something?
Yes.
Oh, really?
Well, because everything we talk about is physical, and this is more... And I guess it's a physical...
Don't tell me you're going to go to emotional.
No.
Oh, okay.
But it's kind of maybe in that area. It's balance.
Uh-huh.
I was reading an article about a lady who was having balance problems and went to a chiropractor, and whatever he did. So, what do you do? It's in the ear, right?
Out of all of this time, you're exactly right. That's so important to us, and it's one of those things that is invisible to us, the sense of balance.
Yeah,
we don't
like
even
emotion.
think about it.
Yeah,
right. And that's great. That's a great topic to talk about, because there are usually three things that help you with your sense of balance, and it's your vision, your ability to know where you are in space, and your ear. And those three things are very important, because if you're missing one or two of those, then you have a tendency of falling. And so, and again, it's one of those things in your health and in your body that you don't really realize or think about until you have a problem with it. Until you wake up in the morning and the room is spinning, and you stand up and you feel like you're falling to the side, and it's such an uncomfortable feeling. And it could be dangerous too, because if your sense of balance is off, there could be a tendency of you falling and injuring yourself also. So when we look at balance, we look at the ear, we look at the ability for the brain to know where the body is in space, called proprioception, and the vision also. This is why sometimes when you have two of those systems not working, you are highly likely to have a fall. So in the middle of the night, some people will get up and go to the bathroom. And so if their vision is not good, or if the light is off, now you took out one of the three.
Yes, that happens to me.
So your other two are your ear or your sense of positioning of your body in space. So if you have a poor positioning, and with age, what happens is we lose our sense of position in space, called proprioception. Why? Because we don't use our feet like we did before. When we were kids, our feet are on pedals, so the feet are moving and sending messages to the brain, so the brain and the body are connected to know where they are in space. When you're on a ladder, when you're on a jungle gym, your feet are moving constantly, and you don't realize they're doing that, but they're sending messages to your brain. But with age, what we do sometimes is we stop those little fine movements of the feet, because we're not on uneven surfaces, so we start walking more flat-footed, and we don't really use that proprioception sense. And you know, as well as I do, if you don't use something, you lose it in the body. So if the proprioception sense, or the ability of the feet to know where they are in space, is gone or reduced, and if the vision is down and you get out of bed and you walk to the bathroom, then you're only depending on one of the three, which is your inner ear, and then that can cause you to fall, because you don't have all three or two of them helping you with your sense of balance.
And if we fall, then we need to come to you for the damage that's caused from that.
That's right. It might be that I can't help you. It might be a fracture, which means that you have to go to the orthopedic surgeon. But yes, there could be injuries to neck, back, joints because of that.
Yeah.
Hence, we want to, at the Fakori Medical and Chiropractic Center, rebuild people's proprioception, whether they realize they have a problem or not, because it could be a problem later on for them. So another example of loss of proprioception is if you get in an accident. If you get in an accident, then what happens is that you don't walk the same. Or if you have knee pain, or if you've hurt your foot, you walk differently. And that changes your body's ability to understand where it is in space, or again, the word proprioception. And that slows the healing process down, and that's a habit that you can develop the rest of your life, which later on can cause falls and things of that sort. So at the Fakuri Medical and Chiropractic Center, we have a 2,000 square foot facility that is a physical rehab center. And in there, Brady, Travis, and Tyler, our three wonderful rehab specialists, will actually develop a sense of balance and, let's say, re-propriocepting people, getting that proprioception sense back again. How do they do that? They do that with wobble boards, where you stand on uneven boards and and it makes your feet start working again, and fires those messages from the feet to the brain to re-educate the brain and reconnect the body and the feet together, which is important, because if your brain doesn't know where your feet are, if you go on an uneven surface, you'll fall. If you twist your ankle, your body won't sense the twisting and won't pull it back and protect you, but you'll continue twisting it further and more damage. So for seen reasons and for unseen reasons, we developed the proprioception as part of our rehab protocol. They also have physio balls. They also have a certain. There's so many different ways that Tyler, Travis, and Brady will redevelop the proprioception.
And what is that? What's a physio ball?
Well, the physio ball is where you put. It's the very large ball that you see, the big yellow ball or the orange ball that you see, and they'll use that to move the body in certain positions.
Oh, you're sitting on it.
Let's say you sit on it, and you go to the side. You feel like you're going to fall.
Yeah.
So what's your first instinct?
I gotcha. Yeah, you go back.
Go back.
Yeah,
so what you did, the first time they have to be there with you. You may actually start coming off of it, so they push you back.
Yeah.
But what you did is you forced your body to reconnect the brain with the body, or that sense of proprioception, to swing you back. So if you start to fall out on the street, your body will immediately react, because that connection is there between your mind and your body. So they'll put you on the physio ball. You'll feel like you're falling. They'll go ahead and help you, and after a few times, you'll redevelop that connection, and your body will develop your sense of balance, so you don't fall. And what was very difficult in the beginning becomes very easy. Then they put you on the wobble board and sometimes start letting you catch balls as you're on the wobble board. So
more of a challenge.
Yeah, they're challenging you. So it's developing stages, and this is what our great rehab specialists at the Fakuri Medical and Chiropractic Center do. Is part of the treatment is not only just getting them out of pain, but making sure that they stay that patient gets a total holistic care, so they have less problems in the future.
Right. It's an interesting science, and I have so many more questions, but you have a listener. Well, maybe this line.
But that was a great subject that you brought.
And I have a question or two more, but let's go to the phone first. The phone line is open. If you want to call Dr. Fakuri right now, the Climate Control Source hotline number is 622-WOCA. Good morning. You're on the air.
Good morning, Doctor.
Hey, good morning.
Say, I'm one of these persons that I'm trying to do good all the time, I take a handful of vitamin pills every day, thinking I'm doing myself good. Sometimes I wonder. A very close friend of ours is kind of in the same boat as I am. They listen to this great radio show, these programs here, and they learn about this certain vitamin you should be taking. They read in the paper about that vitamin you should be taking. They watch Dr. Oz, and he says you should be taking this. Before you know it, you're taking a ton of stuff, and you don't know what you're taking.
Correct.
I'm just wondering if your office offers a deal where a person can come in there, get blood work, and find out exactly where they are, if they're taking too much and not enough of this and whatever. The reason I asked, because this person himself had a problem with, he wasn't feeling right. His urine was dark. He goes to his doctor. They made a test. They found out he was way overdosing in vitamin B12.
Right.
And his liver count was way the heck out of line and whatnot. And I'm a little bit concerned about this. It'd be possible to come to your facility and get a workup to find out exactly where I am and what I should be or not should be taking.
Yes. Call the office, 351-3413, extension 4. Say you want a nutritional counseling session with Dr. Fakuri. Throw everything in a bag and bring it to me. And then at that point, we start working with it, because some of the supplements, and even though they're natural, if you take it in high concentrations, you'll have a toxicity occurring within your body.
Yeah.
For example, somebody this morning brought a product, they wanted me to review it, and it was as an antioxidant. But the problem is it has a lot of, not only do you have your main ingredient, but you have your other ingredients.
Yeah.
And those other ingredients were all unnatural, and they were heavy metals, titanium and selenium. And so what they were doing is taking this one product, but secondarily getting heavy metals in their body, which can cause headaches and toxicity.
Yeah.
And that stays in the fat of your body, those heavy metals, and stays within your body. And that's a problem. And so, yes, that's a good point, is that. And then, unfortunately, what happens, we start with one, and like you say, we keep adding more and more and more.
Right.
And then sometimes there's things like vitamin A, vitamin D, and they are in one product, and you have vitamin A and vitamin D in the other product, and so you start overdosing and taking too much of that, and then that has some harmful effects. So what we do is we'll start at the basics, see everything you're taking, make sure the quality is there, number one. And then number two, start making sure that it's that the ratios are correct, and the amount that you're taking is correct also.
Sounds good.
Yeah.
Do you need a referral for this?
No, not at all.
Very good. I go yearly for my checkup, and then I always have what they call a lipid panel.
Yes.
And what that don't tell you a heck of a lot except for your cholesterol and and a few other things, And I personally, I would not like to go to my general doctor and have this kind of a workup, because I don't feel that. And generally speaking, those doctors are really up on nutrition and that they're not knowledgeable enough, and you need to go to a specialty place like yourself to get the correct information.
Yep, and everybody has their specialties, so the medical doctor really focuses on staying current on pharmacological products, and there's a lot there, and they keep adding, so they focus on that. We stay more with the natural products, so we stay up on the natural products and the availability and what's good for you. But, that question comes up quite often, is that it's so often people are saying, for example, my lipids are high, my triglycerides and my cholesterol is high, and I'm going to start taking red yeast rice, or I'm going to start taking fish oil. And then, but the problem is that they don't realize fish oil is an oil, so if you overtake it, you can actually start increasing your triglycerides even higher. So you want to take the right product, but also you want to take it in the right proportion, so that way it's helping you.
Okay, could I have that number real quick again?
Yes, sir. The number's 351. 3413.
3413.
And extension 4 will take you directly to the front desk.
Okay, very good. Thank you very much.
Thank you for the question.
You bet. Bye now.
Bye-bye.
And piggybacking his with the other conversation, could that cause dizziness? Is just a lack of nutrition? Or?
So many things can cause dizziness, and I'll talk about that. But one question he brings up that comes quite often, it's surprising, is do you need to be referred into the office? And the answer is no. If you're private pay, if you have health insurance, if you've been in a motor vehicle accident, you don't need a referral. You can call the office and institute that call directly yourself and refer yourself in, because we are a multidisciplinary clinic, and you can actually walk in and you don't need to be referred.
Yeah, in fact, you might refer a doctor to another doctor in the same building.
That's correct.
You've got a number of doctors with different specialties.
Yep.
So.
For example, this one young lady, we tried to stabilize her. 2-3 visits, she wasn't getting better, so we had to refer her over to the medical aspect for them to take a look and see if there's something that she's experiencing that we're just not helping on one section. And that's the advantage of multidisciplinary all under the one roof, is that you try to help, and if it's not responding the way that you need, then you can quickly, the same day or immediately, refer them to somebody else within the office that can maybe have some insight and help.
Yeah.
But the dizziness that you brought up, dizziness is very interesting. The muscles in front of your neck, called the sternocleidomastoid, these two muscles, one on either side, if those are tight, those can cause dizziness.
That's not good.
If you have calcium within, and we see that quite often in people who are in motor vehicle accidents, because as they go backwards, that stretches that muscle in the front of the neck, and the muscle instinctively tightens down to protect you, and it doesn't know how to relax after that. So they know that the sternocleidomastoid muscle, when it's spasmed, it can cause dizziness. The TMJ can cause it, which is the jaw. The base of the skull, the atlas, the first bone right at the very top of the neck or the base of the head, can cause dizziness. Inside the ear, those little hair fibers that are on the canals can cause dizziness. Sometimes the calcium in the gel inside the ear, when that calcium bumps against the hair fibers, it can cause dizziness. Blood pressure can cause dizziness. Major things like tumors in the head can cause dizziness. So there's so many different causes that we have to evaluate. And having Dr. Shanawani, our medical doctor, helps us in looking at them chiropractically for a musculoskeletal structural problem causing the dizziness, or the possibility of a medical problem that's causing the dizziness, so we overlap each other.
And the dizziness that doesn't apply to a medical problem, that just somebody's dizzy. And the only way I can understand this or relate to it, in Disney World they have these teacups.
Yes.
And they spin. And if you go with a young person, they will spin them really fast.
Right.
And so you get off of this ride, and you know what dizzy feels like when you get off of that thing. But I've heard people complain that they feel dizzy, and like the article I was reading on the internet about the lady, she didn't have a brain tumor or high blood pressure or any of those things. Something just happened with her equilibrium. Am I saying it right?
Yes.
Equilibrium?
Yes.
So what caused, I mean, obviously the therapy you were telling us about, like with the balance board and the ball and all that, I can understand why that would work. But I don't understand why she was getting dizzy in the first place if it wasn't something physical.
Again, there's hundreds of reasons that can cause you to get dizzy. Actually, some of the medications you take can cause you to be dizzy also. So when somebody comes in and plops in the chair and says, "I'm dizzy," we start with a huge bag, and we've got to start taking it out one by one to figure out the true cause of dizziness. And dizziness is very elusive. Sometimes we cannot find the cause, and it's a difficult process to take care of, and some cases are very difficult to treat also. So if you're experiencing the early stages of dizziness, don't ignore it. Get in, let's take a look at it, let's try to evaluate it quickly, because sometimes the dizziness is just an aggravation, it's just an inconvenience, it's benign, that means it's not dangerous to you, but it's just an inconvenience. Other times it might be major. It could be blood in the brain, it could be a tumor, it could be high blood pressure. There's other things. It could be visual problems that are causing you to be dizzy. So it's something that should be evaluated and get a good grasp of, is it benign or is it more a pathology, disease orientated, and then make sure we're addressing it correctly.
And the phone line is open if you would like to call Dr. Vakori. This is a good time to do it. The number is the WOCA Climate Control Source Hotline, 352-622-9622. Dr. Vakori will address your questions. It does not have to be on topic. You might have a question like Hugh just had, where he had a clear question about overdoing what he thought was a good thing.
That's right, and overdoing things sometimes can have its dangers too. Something that comes up frequently, and maybe some of the listeners might realize this too. Some people, believe it or not, pop their own neck and pop their own back.
Oh no!
And they ask, "Is that okay? Is that a problem?" And my answer is yes. It is. It does.
Have you spoken to Dan? Because he does this.
Well, you and I will talk to Dan after the show, and we'll explain to you. Hopefully he's listening to the show, so he realizes that when there's 7 bones in your neck and there's 5 bones in the low back. And the problem is when you see somebody grab their jaw and turn their head, what they're doing is they're moving all 7 bones primarily and simultaneously. Some will move and glide properly, others will jam together, and they will touch joints together and rub joints together, which starts causing arthritis.
Oh man!
So it's the end stages, it's the beginning stages, which will end up in arthritis in the neck. So they're actually damaging their neck because they're not applying an adjustment, but they're just manually just moving their neck in a very general way with a lot of force, and that's dangerous. And so what they will actually do is make their neck unstable. The first time they did it, wow, that feels good, and that may give them relief for 3-4 weeks, because usually people will do that either out of habit, because they saw somebody do it and they just did it and they thought, wow, this is cool. Or number 2, they have a problem and they're trying to get to it, but they can't. So they're moving the wrong bones and can't get to the true problem. In chiropractic, we get to the true problem and take care of that at a single level, not a general level. And so what they're doing is they're moving the wrong bones, making it unstable. So what felt good for 3 weeks, now they have to do it 3 times a day. So what's happening is you can see where the neck is becoming unstable. So when somebody comes in that has been popping their neck and back, what we do is, number one, is tell them to stop it. Number two, we start we find the problem, and then we start treating the problem, not the symptom, not where they're trying to, not the areas that are already moving excessively, but the one that is causing them to feel the discomfort. We make that work better, and then that urge of feeling like they need to pop their neck goes away.
I was listening to a friend talk about his dog,
Right.
who had a hip issue where the hip bone, I guess, or the leg bone, whatever, would come detached, and then the dog knew how to pop it back in. You could literally hear the thing popping back in, and so the doctor who was talking to him was saying, he's eventually going to get arthritis in that joint. One solution would be to actually cut the ball off, and that sounds extreme to me. I mean, I don't know if it's a dog. Maybe we don't do that with humans, but.
Well, I know with humans, because I don't know with the dog, but let's say that somebody has dislocated their shoulder, so the ball has jumped out of the socket.
Yeah.
If they don't get proper treatment for that dislocation, what happens, whether it's rehab, like we would do at the Fukuri Medical and Chiropractic Center, or if something is very unstable, it might need surgery. And if you don't take care of that and address that, then what happens is that ball will keep slipping out of the socket, and every time it rolls over the rim of the socket, it starts making it more shallow. It starts eroding that rim that holds the ball in place.
Oh, really? Uh-huh.
And so it's a cup, and the ball's in the cup, but every time the ball rolls over the edge of the cup, it wears it down to a point that it's not a cup anymore, but it's just like a saucer now, and the ball will keep wearing out. So yes, that movement of the ball out of the socket will accelerate the process of arthritis in the joint, and will end up needing a shoulder replacement or a hip replacement. But that's very rare that happens in the hip. It's usually shoulder that will dislocate and that will repeat the dislocation.
Yeah, I would encourage you, if you are having that kind of a problem, if you're dizzy, don't ignore that. That's something that's not right, and you just don't. You're not supposed to be dizzy.
That's true, and it's a team approach. At the Fukuri Medical and Chiropractic Center, one lady, a very nice lady, she's known us for many years. She was in a car accident. She came in. We treated her neck, mid-back, low back for 2-3 weeks. She's doing fantastic in those areas. Shoulder continues to bother her, but she was holding the steering wheel. So we did an MRI of the shoulder, and guess what? A complete rupture, a complete tear of the rotator cuff.
Oh, wow.
And that means her shoulder is just never going to function properly, no matter how much conservative treatment that we do at the office. So what we did is we referred her to the orthopedic surgeon, and the orthopod looked at her, and she's scheduled for surgery in December.
Okay.
So we could take care of her neck, her mid-back, her low back injuries, but we needed to call in a team player, and that's what we do all the time. When we have somebody in a complex situation with bad injuries from a motor vehicle accident, we'll take care of them, and the things that are outside of our office, usually surgical, we'll evaluate them and send them to the best surgeon to take care of those.
And I'm glad you said that, because a lot of times people will say, well, chiropractors don't believe in like surgery or what they call traditional medicine. And in your case, you not only will recommend it, but the surgeon's right there.
Yes, well, what we do when we're dealing with somebody is we are a multidisciplinary clinic. We're a mixture. We're not a chiropractic clinic. We're not a medical clinic. We're not a rehab clinic. We're all of those things combined under one roof. And we could take care of the majority of the problems. But for those cases that we can't or that are not responding, then we'll investigate further what the cause is, and then we'll refer that patient out to the right individual, the right profession, the right specialist to be able to take care of that.
And I guess it's my obligation to the listeners to make sure that if we have an important message, that they get the gist of it. And the gist of your message is always, don't wait. You've got this 3-day rule.
Yes.
It's a very good rule. If you're dizzy, we usually see if you're in pain for 3 days, call you. But what if dizziness? 3 days later, you're still feeling it. Go get it checked.
Yeah. If something's not feeling right in your body, if you feel your finger, if you're feeling tingling in your face, if your foot's going numb, if you're dizzy, if your back is bothering you, and it's not clearing up in 2-3 days, then you should be on the phone, scheduling an appointment, getting evaluated, so we could see the outcome, the cause, and take care of that situation for you, whether it's within our office or outside. Case in point, young lady, 15 years old, big athlete, is having quite a bit of back pain, not responding to conservative care like it should. So in further evaluation, we're finding that her scenario is not really a physical, but more of a stress-induced pain. And so we call that the psychosomatic, where the mind will put stress on the body and reflect itself as pain.
So the emotional, I mean, in the beginning, you were trying to guess where I was going. Emotional really does affect the physical. So.
Exactly. And so for her, again, we can't take care of everybody, but we can guide them to the right place if we can't take care of them at the Fakuri Medical and Chiropractic Center. And for her, she needs more somebody to help in managing that stress and help her with that.
And I imagine it's a two-way street at your facility, whereas if you as a chiropractor feel like it should be an issue addressed by a surgeon, then you send the patient there. The surgeon might say the exact opposite. You really don't need surgery, you need chiropractic.
You hit the nail right on the head. That's exactly right. Yeah. Before, it wasn't so clear-cut, but now specialties know what they can do and what they can't do, and we work together in a wonderful team approach, which is better for the patient, more cost-effective, and a better outcome, and the patient doesn't suffer so long, too. Instead of trying different things, we get to the bottom of it very rapidly, and we can give an example on that. But by doing that, we see that if somebody's been in an accident, they go to the emergency room. The emergency room says, go see your primary care doctor, your medical doctor, your PCP. They go there. Of course, he doesn't want to deal with headaches and neck and back pain. He prefers doing the lipids and triglycerides and the heart. So he will refer them to us because that's our specialty, is being able to take care of those trauma injuries. That's what we do all day long. That's what we've been doing for 25 years. And so with that, we can take care of that. And likewise, if we have somebody coming in with a headache and it's a blood pressure induced headache, that's not our area. We'll refer them to the PCP or primary care if it's severe. Sometimes we get the ambulance and take them right to the emergency room to get them under control, so that way they don't have a problem.
Don't wait. If you're hurting, if you're dizzy, if anything is off, call the doctor. And what is your number, doctor?
The number is 351-3413. Option number 4 will take you to our patient care coordinator, Amy, or to the front desk. They can answer any questions that you have and help you and schedule an appointment for a consultation exam. All
right, Dr. Riad Fakuri, thank you for all you do for all of us.
Thank you.
And we'll see you next week.
Look forward to it.
We'll take a little break and be right back.
Hello, this is Dr. Riad Fakuri, chiropractic orthopedist at the Fakuri Medical and Chiropractic Center. Listen in to the Head to Toe Care Show every Wednesday, 11 a.m., right here on WOCA. Learn how your body works so that you can help yourself. We're available to answer your questions every Wednesday at 11 a.m. on WOCA, The Source. That's Dr. Riad Fakuri on the Head to Toe Care Show, 1370 a.m. and 96.7 FM.
Ocala's information station, 1370 WOCA. Ocala.
The weather is brought to you by myfwc.com. Life jackets save lives. We're at Florida. A nice day today with plenty of sunshine, but on the cool side, high 66 to 70. Tonight clear and chilly. Lows ranging from 43 inland to 49 at the coast.